Hello and welcome to a new lecture on an important topic in community medicine. It is the levels of prevention and modes of intervention. This is the bread and butter of community medicine, where we also call as preventive medicine. In preventive medicine, levels of prevention and modes of intervention play a major role for preventing of diseases. So let's jump directly. What are the specific learning objectives? At the end of this session, the learner will be able to differentiate between control, elimination, and eradication of disease and apply levels of prevention. What are the levels of prevention? Again, also the student or the learner also will come to know what are the modes of intervention. And the next slide, disease control. What is disease control? The disease agent is permitted to exist in the community at a level it ceases to be a public health problem. It means the disease under check. Disease is under check. The disease is present. It is present, but it is under check. Like it will not cause a big problem. The disease generally will be there in the community, or people will be having the disease, but it will not cause a public health problem like an epidemic or a pandemic. So that does not have the potential to cause a public health problem like an epidemic. So hence the disease can be just controlled or under check. So there is a state of equilibrium between agent, host, and environment. Next is the aims of disease control. What are the aims of disease control? It aims in reducing the incidence of disease. Incidence of disease here means occurrence of new cases. Already the old cases might be there, they are there, as I said in the previous slide, that the disease can be controlled. The disease can be controlled. In the disease, if the disease is controlled, it means that the disease is there in the community. It can be uh, self-limited, like it is under check. It cannot cause any big problem, or it cannot cause any public health problem like an epidemic. So the incidence of disease or the new cases are prevented. Then the duration of the disease, disease tries to be in the disease, one of the aim of disease control is to reduce the duration of the disease as much as possible by either appropriate treatment or prevention of complications, and reducing the risk of transmission of infection. You reduce the risk of transmission of infections by taking appropriate measures. Like for example, we use the mask. So it's one of the classical examples for reducing the risk of transmission of disease. So that is one of the aim of the disease control. And the fourth one is to reduce the financial burden of the community. So as you know, if there is if disease is not controlled, if you think like this in the opposite way, if the disease is not controlled, then we can think of the money spent on the drugs, on the management, on the investigations, on the treatment. All these things are uh, they account they give they make the person spend the money. So if money is spent, it will cause a financial burden on the community. So the disease control aims in reducing those financial burden. So next is disease elimination. So it is interruption of transmission of disease from large geographic regions. Like only the disease transmission is reduced, or it is stopping of the disease transmission. Because if the disease transmission is stopped, then the disease does not spread further. Disease might be present. Disease might be present. Disease is not eradicated completely. It is not completely taken off. Disease is definitely there, but it is at a reduced incidence. That is, a new cases are prevented by, if you stop the transmission, if you stop the transmission of the disease, if the disease is not getting transmitted, so new cases will not occur. So if new cases are not occurring, it means the disease is eliminated. So this is a precursor for eradication. That is, if you achieve elimination, it is possible to achieve eradication. So if you stop the prevention of transmission of disease, then the disease can be eradicated in future. So you stop the prevention of, or you stop the transmission of the disease. So it's a precursor for eradication. Now the examples, classical examples, measles and polio. By the way of vaccination, by the way of immunization, measles and polio transmission is reduced, and when transmission is reduced, then new cases will not occur. New cases will not occur. So that's the crux of the slide, disease elimination. Now next is an important thing, disease eradication. Disease eradication, where termination of all transmission by extermination of the infectious agent. The infectious agent ceases to exist. Like once you stop the mode of transmission, once you stop the transmission, then the infectious agent lives for a period of time. Either the patient becomes cured or the patient dies, but it will not transmit the disease. So once either the patient becomes cured, means the infectious agent is dead, or if the patient is dead, again the infectious agent is also dead. So it is not transmitted to anybody. So this way, completely the infectious agent is eliminated or terminated. It is eradicated. That is termination of all transmission by extermination of infectious agent. The infectious agent, or the classical example for this is smallpox, cessation of infection and disease worldwide. Throughout the world, you will not get even one single case of smallpox. Smallpox has been eradicated completely. Smallpox has been eradicated completely. There is not even a single case of smallpox in the world. Where you first, what they did, they stopped the transmission of smallpox. See that whenever a disease occurs, the first step is disease control. The disease is controlled in such a way that it poses to be a major public health problem. It should not cause an epidemic. After that, the transmission is reduced. Once its transmission is reduced, or once its transmission is stopped, then the elimination occurs. Once elimination occurs, once transmission is reduced, either, as I said, either the infectious agent dies, or the person with infectious agent dies. So once the source itself is eliminated, once the source is eliminated, either the patient gets cured or the patient dies. But there is no transmission, the source gets eliminated. Once the source gets eliminated, the infectious agent also gets eliminated. So in this way, throughout the world, the infection gets ceased, or the ceased. So the infection stops. There is no transmission worldwide. There is no infectious agent through worldwide. Now if you want to find a smallpox virus, they are found only in the labs, like the labs of Center for Disease Control in Atlanta, and in Russia. So only two places the sample of smallpox virus exists. So the classical example of disease eradication is smallpox. Now if you still fail to understand the difference between elimination and eradication, this slide will help you. So what is disease elimination? Interruption of transmission in a specific geographical area. Like polio might be eradicated in a place, but still there will be some polio cases in some other place, some other country. India might have eradicated polio. For example, in some diseases X, some disease X is eradicated from India, but it will be a problem in some other country. So elimination means you eradicate or you completely eliminate that disease from one geographical area, but still it's still a problem in some other geographical area. So elimination is that. Whereas eradication is like elimination. The example is classical example is polio, because many countries still have polio. Although it is eradicated, India has been declared polio free, but still polio exists in many other countries. So in a disease eradication, complete termination of infectious agent throughout the world, there is no, not even one single virus of smallpox. So it is eradicated completely. So disease eradication means no disease at all, whereas disease elimination means no disease in one place, but the disease might occur in some other place. So that's the main difference between elimination and eradication. Now comes the concepts of prevention. Once we know about the disease, then we start thinking about the concepts of prevention. Preventive medicine aims to intercept the cause to prevent a disease. So, what are the levels? There are 4 levels of prevention. In fact, there are 5. The newest concept is, I'll tell you later. First is a primordial prevention. Second is primary prevention. Third is secondary prevention. Fourth is tertiary prevention. There is one more which I have not mentioned here. It is quaternary prevention. The fifth one is quaternary prevention. Quaternary prevention, again, that is a new concept where we try to prevent the unnecessary complications caused by doctors. Unnecessary complications. So the iatrogenic, what we call the complications that occur because of medical interventions, unnecessary medical interventions. So those are prevented. That is called quaternary prevention. Anyhow, it is. We'll take it in the next class. But here we will concentrate on these 4 types of prevention: primordial, primary, secondary, and tertiary. So, primordial prevention. Primordial prevention is the prevention in the truest sense. It is the prevention in the truest sense. That is exactly what exactly is prevention. This is before the disease occurs, you stop it. You prevent something means you prevent that thing to happen. You prevent an incident to happen. So means you stop the incident to happen. So it is the truest, this one. So it prevents emergence of risk factors in population groups. You stop the risk factors completely. The risk factors for uh, uh, chronic communicable non-communicable sorry chronic non-communicable diseases like diabetes, hypertension. There are different types of risk factors, non-modifiable and modifiable risk factors. Non-modifiable, of course, cannot be stopped, cannot be modified, like age, gender, genetic makeup. This cannot be modified, so that cannot be prevented. A person who is aging, we cannot stop the aging, we cannot change the gender, we cannot change the genetic makeup. So these are called non-modifiable factors that cannot be stopped. Whereas the modifiable risk factors, like smoking, then lack of exercise, eating of unhealthy food, fast food, unhealthy food, or taking things which are harmful to human health. So that all those things can be stopped. That all those things can be stopped or modified. Those are modifiable risk factors. So these risk factors can be stopped. Now, this primordial prevention, commonly we say lifestyle prevention. All these, the smoking, taking of healthy food, or stopping of unhealthy food, stopping of smoking, stopping of or starting of exercise. If somebody has a sedentary lifestyle, they just sit without doing any exercise throughout the whole day. So that stopping that bad habit and starting of an exercise, that is an example of primordial prevention. where you stop the risk factors from developing in a person. Once you stop the risk factors from developing in a person, the disease does not occur. So, the intervention commonly in how to prevent risk factors, it is by health education. You educate the public, you educate the people who are at risk of disease, you educate the general public, or you educate the people at risk of disease. Like for example, a person has diabetes, father and mother have diabetes, a child will definitely is very much prone for getting diabetes. Child is very much prone for getting diabetes. So for that, we tend to educate that kid for taking control of risk factors, or the risk factors should not occur before itself. So how we stop that risk factors? You tell him not to smoke, tell him not to eat unhealthy food, tell him not to tell him to exercise. So all these things are done by the way of health education. So that is the intervention in primordial prevention. Primary prevention. Now in primary prevention, after the primordial prevention fails, primary prevention occurs. I mean, we think of primary prevention because once risk factors, we try to stop the risk factors, but still risk factors develop. After risk factors develop, they are there, but that risk factors should not cause disease, should not cause disease. For that we do primary prevention. Here in primordial prevention, we stop the emergence of risk factors. We, even before the risk factors emerge, we stop it. We try to stop that. But now, once the risk factors emerge, we have to prevent the person from getting the disease in spite of the risk factors. So for that, we do again, even this is also a true sense of prevention. That is primary prevention. We take action before the disease onset to remove the possibility of occurrence. Risk factors are there, but the disease should not occur. For that, we stop. The actions we take to stop the occurrence of the disease is called primary prevention. So the WHO has given, the World Health Organization has given two strategies: population mass strategy and high risk strategy. Population mass strategy means strategy to for primary prevention among the general public. So general public, we do a health education, and we give vaccination throughout the, for all the uh, people, for all the population, for whole of the population we give the different vaccines, and we give education. We tell them the hazards of smoking and all those things, and we stop them from taking that risk factors to a higher level. So we stop that disease to occur in a population. So the strategy which we apply to prevent the disease in the population is called population strategy or mass strategy. So high risk strategy, high risk, there are people who are at high risk. Like for example, I just now a little while ago, I just mentioned a person, father and mother both have diabetes. Child is at a high risk of developing diabetes. So we try to educate, or we try to prevent that disease to occur in that high risk category. So for that, the action which we take to prevent the disease in that high risk patient, or high risk would be patient in future, that is called primary prevention, high risk strategy. So example, vaccination, NCD risk reduction. So vaccination is a general population strategy, mass strategy, whereas NCD, non-communicable disease risk reduction in high risk people, is high risk strategy. So examples of primary prevention, common examples: brushing of your teeth daily to prevent dental cavities, the cavities in the tooth; exercising to prevent becoming overweight. Again, that overweight can lead to obesity. Obesity can be a part of developing diabetes in future, or hypertension, or coronary heart disease. All these diseases are linked to obesity. That obesity occurs because of uh, I mean, as a later complication of overweight. So, for to prevent a person to becoming overweight and obese, we we tell him to exercise. We promote exercise. So, wearing seat belts in cars to protect yourself if you are in an accident. So, wearing of seat belt again, accident has not occurred. Accident is the disease, if for example. So, before the accident occurs, you wear seat belts so that even if there is an accident, the crash is minimized and the person who is wearing seat belt is protected. So, that is primary prevention. Secondary prevention. Secondary prevention, now disease has, if primary prevention fails, if even after risk factors are we try to control, but still there are some people who will not exercise in spite of knowing that their parents are diabetics. They don't exercise, they take unhealthy food, and they smoke. All those things. Their parents, if some persons have a family history of heart disease, a family history of hypertension, family history of diabetes, all these things are there. So still, a person does not take precautionary measures. He lands up with the disease. Now, once the disease occurs, we, as soon as we come to know that the disease has occurred, we tend to stop that disease from progressing. We don't want that disease to go for complications. We stop it. So that stopping of disease or halting of disease progression is called secondary prevention. So mainly early diagnosis and treatment. Early diagnosis and treatment is the uh, crux of secondary prevention. Now, early diagnosis is like if you screen persons for blood pressure. Somebody comes to your clinic, gets checked randomly, you check his blood pressure and you find out that he is having a high blood pressure. You call him daily for 3 days, you check his blood pressure, you find that all the three readings are increased. All three readings are increased. Then, and also he has a history of a family history of hypertension, father had hypertension or mother has hypertension, all these things are there. So for that we can think that this fellow has hypertension. We can start off with treatment. So not necessarily pharmacological treatment, not necessarily treatment with the drugs. We can go for non pharmacological treatment like yoga, like meditation, like relieving of stress. So that is blood pressure monitoring. Then the second image which you see here is a mammogram where a woman is getting her breast screened for any cancer or any tumor. So for that, for breast carcinoma, for that she is putting her breast on in the machine where it scans for any tumor. So that's a mammogram or mammography. This is again a way of diagnosing the tumor. So early diagnosis before the tumor occurs, before the cancer progresses to a later stage. At an early stage, if it is detected and treated, that cancer can be treated. The cancer, there is definitely treatment for cancer if it is detected at an early stage. So secondary prevention is that stage in which you try to do an early diagnosis. And then pap smear for screening for cervical cancer, pap smear is done. So for pap smear, if you do a pap smear, you come to know whether the person is having cervical cancer or not. So pap smear again early diagnosis. And then treatment for some any disease, any treatment, it can be any treatment, it can be insulin for diabetes, it can be oral oral anti-glycemic drugs or oral hypoglycemic agents, OHS. They are given for diabetes, or it might be antihypertensives for uh, hypertension, or it can be any antibiotic for an infection. So even if there is an infection, to prevent the complications of that infection, we have to give antibiotics. So once you start giving antibiotics, then there will not be any further complications, and the patient might get cured. So this is secondary prevention. Now tertiary prevention, it reduces impairments and disabilities. Impairments and disabilities, and it improves quality of life for chronic disease patients. Improves, like some people, some person, like secondary prevention again also has failed. For example, after getting the disease, is not gone for an early diagnosis. Either the diagnosis has been detected, or the disease has been detected late, or diagnosis has been done late, and treatment has been started at a later stage, not at an early stage. At an early stage, we did not get, either we did not get a chance to screen him, or there is a the screening has been done, but he has not taken treatment. There are people who don't take treatment at all, so that there is no compliance. Or even after getting given treatment by the doctor, the patient does not take it for many days and many months and many years. Then he goes for this complications. So for that management of complications is called tertiary prevention. So manage what management, that's chronic disease, chronic conditions management. So how you can do, give a insulin therapy. Insulin therapy for diabetes. To prevent the complications, we tend to first we try to give oral tablets. Once it does not get controlled, we go for insulin. So that insulin treatment, it can be a part of a tertiary prevention. Then that is, we tend to stop the complications. But once the complications have occurred, we have to go for the interventions like dialysis. There is, like, as for example, a diabetic will have complications like a neuropathy, nephropathy, and a retinopathy. Retinopathy, which uh, has complications in the retina, the vessels of retina. Nephropathy, complications of in the kidney. Neuropathy, complications in the nerves. So once nephropathy occurs, kidney is damaged beyond repair, and kidney cannot filter anything. A person might have increased urea, increased creatinine, because of non-filtering, it's not getting filtered because the kidney is not working, and that can lead to complications, and that can eventually lead to death. For that, dialysis, we do a dialysis wherein the machines take the role of a kidney. They try to take out the blood, filter it, and we transfuse it back to the person. So chronic dialysis, that dialysis is a treatment modality in complications of diabetes. So for that, that is tertiary prevention. We are trying to rehabilitate it, or we are trying to prevent the complications. If complications have already occurred, then we go for rehabilitation. Now there is one more thing called cardiac rehabilitation, where the patient is assessed, nutrition counseling is given, weight management has to be told, blood pressure management, lipid management because of increased lipid in their blood. Then, if he has diabetes, that has to be managed. Tobacco cessation, where he has to be told not to smoke further. Then, psychosocial management. All these things, exercise, all these things form a part of cardiac rehabilitation. A person might have MI or some cardiac condition, myocardial infarction, as you generally we call heart attack. Once somebody has heart attack, then we go for treatment. We go for an angioplasty or a bypass surgery, and after that we go do a cardiac rehabilitation of all those steps which are being shown on the slide: weight management, BP control, control of the smoking, all those things. So these are the levels of prevention. Now modes of intervention, these are linked to levels of prevention, linked to, like primary prevention has the modes of intervention, health promotion and specific protection, and secondary prevention has early diagnosis and treatment, and tertiary prevention has disability limitation and rehabilitation. So what all we spoke till now also constitutes the same thing for uh, modes of intervention. Now, attempts to interrupt the usual disease sequence, the types of interventions are health promotion, specific protection. Now, these two constitute primary prevention, which we spoke about. Early diagnosis and treatment, this one constitutes secondary prevention. Disability limitation, and rehabilitation. These two constitute tertiary prevention. So the first two constitute are a part of primary prevention. The third one, early diagnosis and treatment, is a part of secondary prevention. Disability limitation and rehabilitation are parts of tertiary prevention. Now, health promotion. The strategies for health promotion to promote health among the population. Mind you, what I said, primary prevention, we try to prevent the disease before the onset, before it occurs in a person. That can be done by health promotion. Health promotion. So in the health promotion, that can be, the health can be promoted. If you promote health, disease will not occur. For that, you need to do health education. The first one, health education. So you need to educate the person about the importance of health and how to maintain health, how to remain healthy, or how to be healthy. That has to be educated. The health education has to be done. Environmental modification. You can modify the environment. How you can, if there is air pollution, stop the air pollution or control the air pollution so that a person breathes fresh air, good air, and does not get disease because of air pollution. Water pollution, clean the water before drinking, purify the water before drinking. So if it is not purified, it can lead to disease. So all these, the risk factors are there in the environment. Before a person takes it and he gets the disease, we stop that disease to occur. So that is primary prevention. And in that health education, then environmental modifications, nutritional interventions for people who eat unhealthy food. For that also, we tend to stop them from eating unhealthy food, and we promote eating of healthy food. Healthy food, rich of vitamins, rich of minerals. So, lifestyle and behavioral changes. Lifestyle, we have a sedentary lifestyle. People nowadays, they say sitting is the new smoking. Sitting for long time without any exercise is a new smoking. We ask them to exercise, or every 20 minutes they need to get up and go for a small walk, and then again come and sit. If they have, if their job is inevitable, you have to sit there. Sitting is inevitable in their job. Then we have to ask them to exercise or to get up, take a small walk every 20 minutes or every half an hour, but they should not be continuously sitting. So exercise is a part of lifestyle modification. And smoking, not to smoke, not to drink alcohol, not to have unhealthy behavior, all these are lifestyle modification. So health promotion can be achieved by these four steps: health education, environmental modifications, nutrition intervention, and lifestyle modification. Then specific protection. Specifically, we try to protect somebody specifically or against specific diseases, like immunization against vaccine preventable diseases, like immunization against polio will protect you against polio. Immunization against measles will protect you against measles. Immunization against hepatitis B will protect you against hepatitis B. So this way you protect a person from some specific diseases. That is called specific protection. So specific nutrient supplementation. If somebody has iron deficiency anemia, like somebody might get iron deficiency anemia because of iron deficient food, so we give iron as supplement. So specific supplementation so that iron deficiency anemia is prevented. Okay, so that's injury protection. Wearing of seat belt, wearing of helmet, you protect yourself. Wearing of a quality helmet, it protects you from injury. So before the injury, before the accident occurs, we tend to use preventive measures. Then chemoprophylaxis, like you are in a area where malaria is a public health problem, malaria is common, so you visit that area and there are a lot of mosquitoes which might bite you. Before that you get malarial malaria infection, you take some drugs. Those are called chemoprophylaxis, like for example malaria. Or you happen to eat in some roadside dhaba or restaurant, and then there you might have some food, and you feel that it is unhygienic. So after coming out you just take some tablets of commonly speaking, commonly people take doxycycline. It's a broad spectrum antibiotic. So some doxycycline is taken before that infectious agent has gone inside, and before it causes some problem you take the antibiotic to kill that infectious agent. So that is called chemoprophylaxis. And then the next one, early diagnosis and treatment. It is same as secondary prevention. So it detects early disturbances in health before irreversible changes, and it reduces high morbidity and mortality rates. As we said in the during the uh, secondary prevention, as we said, we have to do a screening of some disease, screening of some disease, and then a screening like a blood pressure screening, pap smear, mammography, to prevent blood cancer, breast cancer, sorry, breast cancer, and then pap smear to prevent cervical cancer, and then screening of bp and checking of blood sugar by the way of glucometer. That all these things uh, are a part of early diagnosis and treatment. Once you do an early diagnosis, you start the treatment immediately, prompt treatment. Early diagnosis and prompt treatment, you do a immediate treatment so that the disease does not progress to further complications. Okay, the third one, the next after early diagnosis and treatment is disability limitation. Disability limitation is a part of tertiary prevention. So tertiary prevention, so a disease can lead to impairment, and that impairment can cause disability, and that disability can lead to handicap. Now if I tell you like this, you will not be able to understand. You will not be able to understand. That's why I'll put an example. Accident accident, or it might be like we can call it as a disease, something, an accident. When accident leads to a loss of foot, because of an accident a person might lose his limb, so that becomes an impairment. Because of, now because of that loss of foot impairment, he cannot walk, so he is disabled, he cannot walk. And because he cannot walk, he is thrown out of the job, or he will not get any job if he is a prospective job applicant before accident. Because of his inability to walk, he is not employed, so it becomes a handicap. So all these are interlinked. So because of the accident a person becomes impaired, because of losing of a limb, or because of losing of eyesight, or anything. And because of that he cannot, like if he loses eyesight, that becomes an impairment. And because of losing of eyesight, he cannot see, he becomes blind. It might be partial blindness, total blindness, and because of that he is denied a job. That becomes a handicap. So that is disability limitation. We try to limit the disability, we try to stop the disability from occurring. How do we stop the disability from occurring, we have to prevent the accident. If accident is not preventable, at least we try to, after the accident, we try to minimize the effects of accident. So disability limitation. Rehabilitation, again there are four types of rehabilitation: medical, social, education, and vocational rehabilitations. Medical rehabilitation where you tend to uh, take medical management to prevent the effects of disease. So some disease has occurred, medical rehabilitation, we had this chronic dialysis of kidney, in kidney failure. If there is renal failure, what the medical interventions you take to rehabilitate the patient. So you do dialysis to rehabilitate that person. That is medical rehabilitation. Vocational rehabilitation, a person loses employment because of his disability. We try to give him work. We try to put him in a place where he can be employed. Like for example, a person meets with an accident, and his impairment is he has lost his eyesight, and because of his eyesight he has lost his eyesight, means he is blind. That disability is blindness, and because of that, the job which he was doing, he is not able to do the job. He can take up the job of some telephone operator or something, wherein he can, or librarian, or of course with assistance, not alone. So he can take assistance and he can be employed in a place where he is fit to work. Even as a blind man can take a lecture, so he can still be appointed as a lecturer. Nothing wrong in that. So we need to be empathetic for that. So for that, vocational rehabilitation. Social rehabilitation, a person who has this disability, because of disability people shun him. People, he is not fit in some communities, they don't entertain these disabled people. So we try to adjust them, the people who are disabled in that community. That is called social rehabilitation. And psychological rehabilitation, of course, psychologically a person definitely gets scarred because of his disability. So we do a psychological assessment, and then a proper psychological treatment or psychological uh, intervention is done to, so that a person is rehabilitated psychologically. So that is regarding rehabilitation. Now what is the take home message? What did we understand in this lecture? We understood what is control, what is elimination, what is eradication, and we understood what are the preventive levels, what are the intervention and modes of intervention levels. And we'll in future we'll try to understand what is surveillance, monitoring and evaluation in the next lecture. So that has to be uh, in the next lecture that will be taken. So this is the take home message. Thank you. So if you have understood, or if you have not understood, you can still try the quiz in the link which is given below in the description. So that once you uh, take up the quiz, you will be able to understand, or your the assessment or the marks which you get out of 20 questions, how much you get the marks, that will show how much you have understood. Thank you for your patient listening. Thanks a lot. Goodbye.